definition according to my research, my doctorate thesis. And according to me, because I worked with different practitioners, counselors in different setups, I said that supervision is a care support service that is provided to psychotherapists or to counselors by seasoned practitioners. In this forum, we have experienced very seasoned practitioners, people presenting in different fields. And these seasoned practitioners, they do that. They support the counselors for personal wellness and therapeutic competence. At the end of the day, the outcome or the goal is to ensure that this counselor is achieving wellness and is achieving therapeutic competence. I would want to look at the difference between administrative supervision and clinical supervision. When we talk about the word clinical, it means relating to observation. We counselors, we caregivers, we psychologists, we observe, and after observing, we treat. And therefore, we are clinical. It is clinical supervision. And so clinical supervision, where we are looking at the work of a counselor, the way the counselor is formulating goals, the way the counselor is understanding the case and diagnosing, and the interventions that the counselor is giving. So clinical supervision focuses on the professional development of the supervisee with a goal to develop a competent and an effective professional. The question that you were asked by Debbie in the beginning is very fundamental. Do we attend counselor supervision? Do we undertake counselor supervision? Do we go for that servicing? And it focuses on the evaluation of the individual skills of the clinician, so that not so that we can tell the clinician they are not doing well, but so that we can see what they are doing very well and what else they can be able to do for them to improve on their work and their practice. On the other hand, administrative supervision focuses on the mission of the organization and its goals and objectives. So the administrative supervision, we look into the logistics. How many therapy rooms do we have in this particular agency? How many supervisors do we require? Are we having enough therapists for the load of the clients that we have, or for the population of the clients who come to our facility? So administrative supervision maintains the organizational functions and it accounts for the needs of the agency. One of the needs of the agency may be making sure that the delivery of the services is effective and that the clients are happy with the work that the clinicians are doing. Now, when it comes to counselor supervision, what are the principles or the central principles for that counselor supervision? Why do we undertake the counselor supervision much more specifically? And number one principle, the reason as to why we undertake counselor supervision is because it is an essential part of all clinical programs in order to improve the clinical programs in our organizations and in our institutions and agencies, even in our clinics. and that clinical supervision enhances the staff retention and morale. I remember one time I was working as a counselor supervisor in a rehabilitation center. And because of the kind of clients that they were handling, clients who have multiple challenges or co-occurring conditions. Because of that, sometimes the client is having personality challenges, and they are having medical conditions, and they are having psychological issues, and this hurts the counselors in the long run, because this is a lot of intensity on the part of the counselor. And therefore, there was a lot of staff turnover. But when counselor supervision got introduced, they said they were retaining the workers for a longer period of time because the workers were taken care of and they were feeling refreshed and they were feeling rejuvenated. Every clinician, regardless of the level of skill, it doesn't matter what level they are, they can be at a very high level where they can say they have worked in the field for 20 years, for 30 years. So regardless of the level of skill and experience, every counselor requires to receive clinical supervision. And in addition, supervisors need and have a right to supervision for their own supervision. So we call it supervision for the supervisors. So supervisors are not left behind. They too require to receive counselor supervision. So clinical supervision needs the full support of the agency administrators. In situations where the managers are not supporting supervision, then what happens is that even the counselors may not see the need, or even when they see the need, they may not be provided with an opportunity or even with the resources to receive the supervision, and therefore they are not able to do that. The supervisory relationship is the crucible in which the ethical practice is developed and reinforced. Because when we look at counselor supervision, it looks into are the counselors ethical in the way they are handling the clients or they are not. So supervision is supposed to remind the counselors that for them to assure the clients that they are well protected and that the services they are being given are effective for them, then they need to be provided supervision within ethical practice. At the same time, another principle for counselor supervision is to make sure that clinical supervision is a skill in and of itself that has to be developed. It has to be developed by the counselors, and it has to be developed by the agencies or the institutions. Counselor supervision, like for example, in the substance abuse treatment, most often requires balancing between the administrative and the clinical supervision tasks. And it is not only in the substance abuse treatment, but also in all the other areas of specialization, whether it is marriage and family counseling, or even child counseling, or even adolescent counseling, or even workplace counseling, or even or even counseling for medical conditions, or even counseling for special needs and disabilities. All those forms of counseling, supervision need to be developed and specialized or focused in those areas of specialization. Culture and other contextual variables, they influence the supervision process. And this is something that we need to bear in our mind, even as we are supervising. And therefore, supervisors need to continually strive for cultural competence. You may want to ask yourself, are you respecting all persons who come to you, irrespective of gender, or even race, or even sex, and all those other differences that people have? The other principle is successful implementation of evidence-based practices requires ongoing supervision. For example, we may want to ask ourselves, what is the evidence-based practices when it comes to marriage and family therapy counseling? What are the best practices? The best practices for workplace counseling. And for us to be able to adhere to them and to make sure that we are implementing what has been researched and found to be working, then we need to have ongoing supervision. Supervisors have the responsibility to be gatekeepers of the profession. In our professional bodies like Kenya Counseling and Psychological Association, or even Kenya Psychological Association, the counselor supervisors are supposed to make sure that they are gatekeeping for the profession, making sure that the ethos of the profession are adhered to. Clinical supervision involves direct observation of the methods, but sometimes indirect observation of the methods. Because when we talk about direct observation of the methods that are used by the practitioners, we mean that maybe you are observing a counselor when they are doing their work or providing therapy. But in Kenya, we do not mostly use that direct observation, but we use the reported cases so that we can help the practitioner to be able to work through whatever difficulties that they are having with the cases that they have. It is important to appreciate the historical development of clinical supervision. And clinical supervision started in the 1920s and 30s by Max Ettington, and who is credited for introducing the clinical supervision to the Psychoanalytic Society. But when Berlin School of Psychoanalysis was established in the 1920s, a supervision model of teaching was developed at that time. The terms supervision and supervisor started being used alongside the terms counseling and psychotherapy in the 20s and 30s. There are two strands in the history and the understanding of supervision. One emerges from the United States and the other one emerged from Britain. The United States concerned with the conceptual and the intellectual pursuit of the supervision, meaning that they were interested in the training and also the research in the area of supervision, while Britain concerned itself with the practice. And therefore, when we are looking at supervision, we are looking at a distinct discipline, because supervision has its theories. It has its own methods of providing the supervision service to the receivers of the service. And therefore it is a distinct discipline. You can actually be only offering supervision like in Kenya. that is the only trade you're doing. That is your only way of getting paid. Therefore, what we need to do is to continually improve this discipline of supervision, where we are attending to the professionals and the practitioners so that they can get better. When we look at supervision in Kenya, we also are able to see that there is a lot that has been developed in Kenya in the area of supervision, whether we are talking about training or even practice. Because counselor supervision training has taken root in Kenya, with some universities like PAKU taking lead in training counselor supervisors, and Pan-African Christian University, it has taken the lead in training supervisors in MFT, marriage and family therapy. Well, we have seen the TVET institutions or the middle level institutions have done a lot in realizing, one, a diploma, which is examined by Kenya National Examination Council. And it was developed by Kenya Institute of Curriculum Development through the initiative of Kenya Counseling and Psychological Association since 2011. And currently, the psychology sector, where I am the chair of SAC, Sector Skills Advisory Committee, it has presented approvals to TVET CDAC, Technical Vocational Education Training and Curriculum Development Assessment and Certification Council within the Ministry of Education. TVETA is the one that is in charge of regulating the middle level colleges in Kenya. So we have presented a request that we can develop another diploma in counselor supervision, a competency-based diploma, and relevant approvals have been granted. KCPA, since year 2009, it developed an accreditation policy which is used for accreditation of the counseling psychologists ever since. And therefore, we as counselors, what we do is that we provide the requirements so that we can be accredited by Kenya Counseling and Psychological Association. Those levels, there is a slide that you have left, Helen, slide on accreditation levels for KCPA starting, all right. In level 1 of the accreditation levels, we have the student. It's okay, I can see it's not there, or maybe it's the one that is following. And the level 2, we have the associate counselor. That one, that is level 5. The associate counselor status is not level 5. It is level 3. I'm sorry about that. Level 3, the associate counselor status. And level 3, the associate counselor status requires a minimum of a diploma. That is level 2, sorry. A minimum of a diploma, or those with senior counselor status. And they are required to have 500 hours of supervised practice. That means you have to be supervised for you to be accredited, or for you to achieve an associate counselor status, and 15 therapy sessions. Then we have the other one that follows is the accredited counselor. I'm not going to use that slide. The accredited counselor. And after the accredited counselor, we have the senior counselor. And from the senior counselor, we have the accredited supervisor. And from the accredited supervisor, we have the senior supervisor. And all those levels of accreditation, they are the requirements of what is your qualification, how many therapy hours are you supposed to have, and how many hours of supervised practice are you supposed to undertake. And for you to be accredited by KCPA, then there is an amount that is required for you to pay. You can continue, Helen. Sorry for that. I am a senior counselor supervisor. That is the highest level. That is level 7. We continue from there. So what are the functions of supervision? Proctor 1993 looks at 3 components or functions of supervision. And one of the functions of supervision is formative education, which refers to the aspect of clinical supervision that relates to the professional development of the practitioner. That you have to be helped to relate with, are you understanding the theories? Are you understanding clearly the techniques that you are applying, even as you are helping the client in the challenges that they are going through? And the number 3 is the restorative supportive function. As we are doing our work as practitioners, we go through a lot of injuries. We can go through burnout and fatigue. We may experience helplessness and inadequacy and stagnation, and we need to be restored. And counselor supervision helps us to be restored from that incapacitation that we go through as we are helping our clients. And then we have normative managerial function, which relates with the norms of the profession. This may be the ethics or even the policies within an agency or within an institution. And therefore, supervision serves the counselors in those 3 functions: the educative, that you're going to be educated; the restorative, that you're going to be restored, that you're going to be rejuvenated and refreshed if you're going through a difficulty where you feel that you're not like the person you know yourself to be. And then there is the normative that has to do with the ethics of the profession. What do we expect a counselor supervisor to do? The counselor supervisor can be a teacher, promoting self-awareness. Are you aware that you are counter-transferring? I remember one time a counselor said in a conference that she was handling a client, and this client was going through a marital challenge. And even the counselor was going through a marital challenge. And therefore, in counseling, the client said that the husband is a dog. And the counselor said, I think I agree with you to a certain extent. And the reason as to why the counselor said that is because even the counselor's marriage, she was going through a crisis because she had not attended very well to the crisis she was going through. She counter-transferred to the client. Therefore, we need to promote our self-awareness through counselor supervision, and also transmit knowledge as teachers for the practical use and professional growth of the supervisees. We also act as consultants because supervisors provide alternative case conceptualizations. They help the counselors to look at a case and to understand the case in another way, to give alternative views. They provide oversight of the work that the counselor is doing. At the same time, the counselor supervisor is a coach, providing morale building, assessing the strengths and the needs of the supervisees, and suggesting varying clinical approaches that can be used. And also the counselor supervisor is a cheerleader. At the same time, the counselor supervisor is a mentor, is an example, is a role model for the supervisee to learn from. If it is like the skills of counseling, the counselor is learning from the supervisor. What are the characteristics of successful supervisors? We can capture that with the 4 A's of the clinical supervision, which describe a good clinical supervisor. A good clinical supervisor is the one who is available, meaning that the supervisor is open and receptive and trusting and non-threatening. You're trusting the supervisee, even in the way they are presenting. Debbie, is there a question that is being asked? Right? The counselor supervisor is also accessible, easy to approach and speak freely with the supervisee. And the supervisor is able or has capacity to provide supervision, meaning that the supervisor has the relevant knowledge and skills to transmit or to provide the counselor supervision. At the same time, she or he is affable, meaning present and friendly and reassuring. So for those that want to be counselor supervisors, those are some of the characteristics that the supervisee expect from the supervisors. For the supervisees, you can receive supervision in different ways. And one of the ways you can receive supervision is by receiving your individual supervision. Look for your own supervisor and receive supervision from the supervisor. The supervisor is going to give you all the airtime to be able to explain the cases you have, the difficulties that you are experiencing. But at the same time, it is important to attend group supervision. And group supervision is where you are many and you are receiving supervision as a group. And at the same time, there is peer supervision, where people at the same level. You may be doing a particular program and you supervise each other. So supervision for the peer supervisees is not the professional supervision. They cannot be accredited because of going through the peer supervision. And then there is the staff supervision. Within an organization, you may receive supervision as counselors within that particular organization. So those are the forms of supervision that we mostly use in our country. And you can decide the one that you'd want to use. And like I said, at one time you may require individual supervision because you'd want to be attended as an individual. and other times you may require group supervision because you'd want to listen to others who are going through the difficulties that you may be going through, so that together you can be assisted. So the models of supervision, just like I said, that supervision is a discipline, and therefore it has its own models or theories of supervision. And one of the models of supervision in the psychotherapeutic models is the psychodynamic theories. We also have the person-centered theory. We have cognitive behavioral. We have systematic or systemic theories. Systematic theory is in the systemic theories, which are family theories, and we have postmodern theories. But we also have supervision specific models, and there are many. I am just going to mention a few of them, like the integrated developmental model, or even the Lonsted and Scofford model, or the Logan-Bill, Hardy and Delmoth model, or the discrimination model by Bernard and Goodyear, or the holistic burnout model. That is a model that I developed when I was doing my doctorate on counselor supervision as a treatment of counselor burnout. And then we have the Hawkins and Shawhead model. We also call it the six-eyed or the seven-eyed model, and the hallway systems model. When you go to be trained in counselor supervision, you will be taken through some of those models that we have mentioned. I am going to zero in on Hawkins and Shawhead model because it is used a lot by many counselor supervisors, and I'm also going to look at the integrated developmental model. The Hawkins and Shawhead model, when a supervisor is supervising the supervisees, she or he focuses on content. What is the content that is being presented by the supervisee? At the same time, the supervisor is looking at the strategies and the interventions that are used by the supervisee or the counselor. At the same time, the supervisor helps the supervisee to look at the therapy relationship. How was your relationship with the client? The supervisor asks. And at the same time, there is a focus on the therapist's counter-transference, and also on the supervisory relationship. How is the supervisory relationship? Sometimes we talk about isomorphism, that what was happening in the client-counselor relationship is what is happening in the supervisee-supervisor relationship. If there was stuckness, the counselor was getting stuck with the client, the supervisor may be feeling stuck with the supervisee, who is the counselor here. At the same time, this Hawkins and Shawhead model, the one that we are also saying is called the seven-eyed model or the six-eyed model, focuses on the supervisor's own process. And at the same time, the supervisor-client relationship. You as a supervisor, you're also imagining what the client is going through. When the client is being taken through by the counselor with the interventions that the counselor is using. At the same time, the supervisor is helping the supervisee to look at the wider context. And now the IDM, the integrated developmental model. In the level 1, that is the childhood stage. That is the beginner counselor. And this beginner counselor may be starting the training and therefore is a neophyte, having a lot of challenges and asking a lot of questions. And as the counselor is continuing with the training, the counselor starts to understand, this is the way I implement the skills, the way I implement the techniques, the way I implement the different theories. And therefore they are in the adolescent stage. And then the level 3, the RH, that is the early adulthood stage, not childhood stage. And at this point, the counselor is feeling, I understand a lot of what happens in counseling. And then in level 4, one becomes a master. She or he is in the adulthood stage. The markers of growth are looked into in regard to self-awareness and motivation and autonomy. Where is the counselor in regard to his or her self-awareness, in regard to motivation, and in regard to autonomy? When supervision is provided, there is what we call the live observation or the live supervision. And there are those methodologies that we use, or strategies that we use. For example, the bug in the ear, that you are having something in the ear that you're reasoning with, and you can hear what the counselor is saying in the counseling session. And probably you can give feedback to the counselor. You're monitoring, you monitor the session through the one-way mirror. We also talk about the in vivo, where you interrupt the therapy and a supervision consultation occurs in front of the clients. You realize that this will disrupt the session and can even intimidate the clients. There is also the walk-in, where you can walk in, you enter the room during an arranged time and talk with the supervisee regarding what you think the supervisee is doing very well, and maybe you can even intervene a little bit. Then we have phone-in consultation. We can ring a counselor and help the counselor to deal with the session in a particular way. Other methods that we categorize as live observation is using computer technology or even core supervision, where you are together with the supervisee or the counselor and you are listening to what the counselor is doing in the therapy session. Apart from the live observation and the live supervision, we have what we call the post hoc supervision. And the post hoc supervision is where we are allowing the counselor to report, to narrate the cases. And we listen to the case that the counselor is presenting. And we help the counselor to deal with that particular case, with the particular challenges that the counselor is having. So the post hoc supervision is done after the sessions are conducted. And there is a verbal exchange where the supervisor and the supervisee discuss the cases, they discuss the ethical and legal issues, and even the personal development of the counselor. The downside to talking about treatment is that much of the effectiveness will depend on the honesty of the counselor. And therefore, when we attend supervision in the post hoc supervision, onus is on us as the supervisees, the counselors, to be as honest as possible. And for the supervisor to communicate understanding so that the counselor does not feel intimidated by the counselor. There are those methods that are used in the post hoc supervision, whether we are receiving cases or we are helping the counselor to reflect, or we are getting the counselor to take us through the personal notes so that we can help the counselor with the issues that they are having for supervision. So there are those two methods, the live supervision and the post hoc supervision, where cases are presented by the counselor. When we are providing supervision, you can play the role of the teacher or even the coach or the mentor. You are mentoring the supervisee or the counselor, or you're being consulted over certain areas that the counselor is having difficulties. So it all depends on what is the level of development of the counselor supervisor, so that you can have a sense of the kind of methods or strategies that you need to use to help the counselor supervisor. When we are helping the counselor, the supervisees, we can also use the models that are used in leadership. And some of the models that are used in leadership is support, where you are providing high support and low direction, or very little direction. Or you can coach, where you are providing high direction and high support. Or you can direct, where you are providing high direction but very little support. Or you can delegate, and this mostly happens with those counselors who are already established as practitioners. They are master practitioners. There is very little support and very low direction that we are providing. So we can use that in order to help our supervisees. We may want to ask ourselves, when we are helping the supervisees, what are some of the areas that we are going to focus on in terms of the ethical and legal issues in clinical supervision? We can look at the competence level of the supervisee. They can provide their certificates for us to be able to determine that. Or even listening to a supervisee will help us to see whether they are able to apply what they have learned or they are not able to. We look at dimensions of dual relationships or multiple relationships. Is the supervisee aware that he or she is having a dual relationship or a multiple relationship? Maybe a romantic relationship or wanting to start a business relationship alongside a therapeutic relationship. Then there is confidentiality and also informed consent, that the supervisee, is she aware or he aware that the client, for them to agree to enter into receiving therapy, that they need to be aware of the methods that the supervisee, who is a counselor in that context, is using. At the same time, confidentiality. The legal issues include the due process. Is the counselor following the due process? The due process, even in the way a counseling session is managed. Is the counselor helping the client to identify the goals? Is the counselor able to diagnose? So you are helping the supervisee to be able to go through a due process in the way they are handling matters. Then the duty to warn and protect, like when we are dealing with minors or even people who are dependent, that the counselors need to know that they have the duty to warn and to protect the clients who are requiring to be protected, or even people out there who require to be protected. Again, accountability and liability. When we talk about accountability and liability, there may be vicarious liability, that in the process of the supervisor supervising the supervisee or the counselor, and the counselor is doing things that are unethical, then the supervisor is going to be liable in the wrong land. But there is also the direct liability. And the direct liability has to do with negligence. Have I been negligent as a supervisor when I am supervising my supervisees or my counselors? Now, the personal development of the supervisee is important. And this includes the self-awareness, the understanding who they are, the acknowledgement of their talents and potential, the building of their human capital, and facilitating their employability, and enhancing their quality of life as individuals, as people, and contributing to the realization of their dreams and aspirations. What are some of the activities that a counselor is supposed to undertake? One, a counselor is supposed to be a member of a professional body, because within the professional body, the counselor will grow, the counselor will develop, the counselor will mingle with other professionals. The other way is attending personal therapy. And like we saw in the different accreditation levels, you have to go through sessions or therapy sessions that are determined for you to move to the other level of accreditation. You can attend seminars and trainings, and supervisors need to encourage counselors to do that. Even what we are doing, the presentations that we are listening to, is a way we are developing ourselves in a very big way, and leading widely, and having professional mentors, and attending to supervision, and writing journals, and getting in touch with our internal supervisor. Even in a therapy session, we can ask ourselves, should I use the empty chair or not? And the internal supervisor will say, this is not the time to use the empty chair. Don't use it. This is not the time to confront. At this time, the client is requiring understanding. At the same time, personal development has to do with one resourcing himself or herself. The end result is becoming a fully functioning supervisor or a fully functioning supervisee or counselor. You would want to get to that level where you are a master in your field. Allow me, because I'm just about coming to an end, to take you through the holistic burnout supervision model wellness maintenance. when I was doing my thesis for my doctorate, I went to General Motors and I asked them, why do you give us a manual for our vehicles? And they said, because we would want you to use your vehicle for a long time, to know how to service it, to know how to take care of it. And I went to medical practitioners, especially the gynecologists, and I asked them, why do you take women through pap smear? And they said, because we would want to treat before, or even to take care before a disease is developed. And if a disease is starting to develop, then we can intervene before the disease is getting too far. And from that particular thesis that I was doing, I realized that it is important to do supervision as a prevention and to do supervision for curative, meaning that supervision sometimes or many times we attend to supervision so that we can be prevented, maybe from burning out or maybe from getting stuck with clients. And at the same time, we may be injured in the course of doing our work. And at that time, what we are requiring is treatment or curative. And therefore, when we go for supervision, we are willing to go through adjustment. We are willing to go through modification. There are certain things that we are going to change. And there are outcomes that we are going to receive from supervision. One of the things that we receive is resiliency. That it doesn't matter how many cases we are handling, but we are going to be resilient. And we are going to be re-energized when we attend supervision. Other outcomes of supervision are reintegration. You get reintegrated to yourself. You may be feeling fragmented with yourself as a practitioner. Maybe because of the cases you're handling or because of personal experiences that you are going through. And so because of that, you feel like you're not the person you know yourself to be. But supervision helps you to be reintegrated to yourself, to be refreshed, to self-regulate yourself. You feel like you're driving yourself. You are operating from an internal locus of decision-making and not an external locus of decision-making and evaluation. And most of all, from supervision, you attain self-efficacy. The belief in yourself that you can do it. And you know that you can do it because your supervisor is telling you that you have improved so much. And finally, you would want to make sure within supervision that counselors are taken care of and institutions also are benefiting from the supervision. And how this happens is because the supervisors have their own strategies to take care of themselves. And the supervisees have run their own strategies to take care of themselves as counselors who are attending to the clients. And at the same time, we have the strategies that come or the strategies that are used by the institution. The institution may be having like packages or programs to take care of the practitioners within the institution. Those are the institutional strategies, because those institutional strategies will ensure that the counselors are well serviced to be able to take care of the clients. The end result of having institutional strategies and programs that are learning from the beginning of the year to the end of the year in and year out, that the counselors are having their own strategies that are clearly formulated and individualized. And at the same time, the supervisors have their own strategies, sorry. The end result is assured counselor wellness. And this assured counselor wellness is going to give us assured client wellness. Because when a counselor is well, when a counselor is resilient, and a counselor believes in herself or in himself that he can do it, then the kind of work that the counselor is going to do is going to be effective work that is helping the clients to become better and become well. Now, I want to lead out for you a case, and you're going to tell me what are the issues that this counselor is having. This counselor is called Karemi, a counselor in a community-based organization who is known for his hard work and resilience by the community. He has worked in the facility for 2 years now, and everyone in the community knows him. Even the little children do. And lately, some people have commented that he is changing, Karemi is changing, and that he looks lost. His marriage has been working, and the wife ran away, threatening she's not the type that goes back to situations that don't seem to be making sense or situations that don't seem to work. He is losing confidence, and he has been telling a nurse in the facility that he works, where he works, that counseling does not work. Right? He told colleagues, that is, as we continue, he told the colleague nurse that there is no God and that it is useless to invest in spirituality. He attributes the failure of the marriage to himself, and he says he will never amount to anything. For the last 1 week, he has been drinking profusely and goes home singing how useless he is and warning women not to look at him because he's not a husband and a saint material. The villagers are puzzled and are talking in whispers because they have not come to grips with the reality of their changed counselor. He is referred to you for supervision by the section head. The question that I want us to think about is, what personal and professional challenges is Karemi going through? Or what personal and professional challenges is Counselor Karemi presenting with that you need to attend to if you are his supervisor? And at the same time, what challenges would you use? What strategies would you use to help him deal with the challenges that he's going through? The strategies you'd use to help him deal with the challenges that he has. Thank you so much for listening to me. I am now welcoming you to an interactive session or an interactive time so that we can be able to ask ourselves questions and reflect on what I have taken you through. Thank you so much for listening.
Thank you so much, Kathy, for taking us through this session. From the comments, we've had different people just sharing how insightful it has been and how supervision has been very a key thing to do in their fields. We've heard of those who have talked about supervision being empowering, eye-opening, helping them mitigate burnout, and just how much they value supervision. So there are a couple of questions that have come up. I know you've added more concerning Karimi. I don't know if it's okay with you. Can I read the questions? Then you get to answer them.
You can.
Okay. So Alfina asked two questions. So the first one was what factors does one take into account considering setting up and maintaining a supervision practice? What factors does one take into account in consideration in setting up and maintaining a supervision practice? She also asked, is isomorphism same as parallel process in supervision?
Okay.
Then should I ask all of them, or you'll do one by one?
You can ask a group of them, and then I can answer, and then you can lead others. Is that okay with you, Debbie?
Yes, that's okay with me. So there's a question from Anne who asks, how does she roll from counseling to supervision?
How does she?
Roll from counseling to supervision.
The word
I
role.
think changing role, changing from counseling
the role from supervision, from counseling to
because you'd mentioned something close to that in terms of it being a career path.
Yeah.
And then there's a question also from Anastasia and Chris asking, after how long should a counselor go for personal supervision?
How long?
Yes.
Okay.
Probably you can answer those.
Yeah, I can answer those for now. All right. What factors does one consider when you want to set up supervision? Supervision. Am I getting it right?
Yes.
To set up a supervision facility, yeah?
Setting up and maintaining.
Supervision.
Yes.
If you want to set up supervision, say within an agency or within an institution, then you need to consider two key things. Number one, the training. That the supervisors who are providing supervision are trained in the methods of supervision. Because the methods we use in supervision are very different from the methods we use in psychotherapy or when we are providing therapy. And therefore, the supervisor should be trained in the models of supervision, and mostly models of supervision with a focus on the areas of specialization within a particular agency. Is it child counseling that you're practicing, or maybe marriage and family counseling? Then the supervisors should be very well grounded. So there is the training, and there is also the practice that they have been practicing. They have a period of time within which they have been practicing as supervisors so that they too can be competent in supervision. And for us to be able to maintain supervision within a facility, then we also need to make sure that the management within the agency has bought the idea of supervision, and they can see the benefits of supervision for them to give resources towards supervision. So it can be looked at in many ways, where we are looking at training and we are looking at the practice of supervision, where we make sure that supervision is being provided to the counselors within an agency. And at the same time, that the management has mainstreamed within the agency or the institution. And that can be done through capturing it in the policies of the institution. So the management knows that supervision has to happen so that it can be maintained after it has been set up. The question number two, how can you move from counseling to supervision? The way you move from counseling to supervision, number one is, again, you have to be trained in counselor supervision for you to understand those methods of counselor supervision. And after you've been trained in counselor supervision, now you can advertise yourself, or you can start advertising or marketing yourself as a counselor supervisor. In the first world countries, we have supervisors who majorly do supervision, apart from a few cases of counseling, just to remind themselves the challenges of counseling or even the parameters of counseling. You cannot do away with counseling completely, but you might want to reduce the load marginally so that most of the times you are providing supervision rather than providing counseling. But just like I said, and I want to emphasize, don't do away completely with the counseling. Have a few cases so that those cases can be helping you to remind yourself on challenges and competencies that you are talking about when you are providing supervision. How long does one need to undertake supervision? It should be undertaken throughout your period of time that you're practicing as a counselor. As long as you are practicing counseling, you are seeing clients, you should be seeing a supervisor to attend to you for your personal and professional development. KCPA, you have to attend an individual supervision, one individual supervision, and one group supervision per month. According to British Association of Psychotherapy, it is after you have done 8 sessions, then you have to attend supervision. So different professional bodies have different criterion in terms of how you undertake supervision, but it should be in the life cycle of you as a practitioner. You have to make sure that you have your own supervisor and you are attending supervision.
Thank you so much, Kathy. I know there are a couple of questions that are coming up, and but we are way past our time. I don't know whether you can just answer them probably maybe as we wind up. There's a question on whether supervision can be found online, training on supervision, whether it can be found online. And then there's also a question in terms of where can people take supervision courses? Which ones would you recommend?
Like I said, in Kenya, we have institutions that have been offering counselor supervision at different levels. Our TVET institutions, all TVET institutions have been offering counselor supervision. And therefore, institutions like KAPC, Kenya Association of Professional Counselors, Amani, KIPCO, where I am the director, Kenya Institute of Business and Counseling Studies, even East Africa, even Ebulbul, those institutions, TVET institutions, they offer supervision at certificate and diploma level. We have universities that are offering supervision, whether it is a course unit or it is even a short course. And like I said, when I was starting off, Pan-Africa Christian University, they have been offering a course in counselor supervision in marriage and family therapy. At KIPCO, we offer online courses in counselor supervision and also face-to-face, all school-based programs on counselor supervision. But I imagine that from tomorrow, we can have the different institutions that are offering the online programs on supervision to send that to the platform so that we can be able to have the different institutions and the kind of offerings that they are having.
And that's profound, just being able to know that we can find supervision online. There's an observation that has been made by Kate here. She says that there should be harmonization of counseling courses in all institutions in Kenya, because she did supervision course and she wasn't aware of almost half of what the information you have given. How can this be taken? I mean, in terms of different institutions not being able to give the necessary information in terms of supervision?
There has been harmonization already, Debbie.
Okay.
And Kate, who has asked the question, because like I said, we have a diploma that was developed at Kenya Institute of Curriculum Development and is examined by Kenya National Examination Council. And therefore, already that program is harmonized. And the certificates that you get are national certificates, because if you do a NEC program, then the certificate is going to be a national certificate. And I also said that KCPA, it has a committee that is called the TVET committee. And that TVET committee, where I am the chair, we have already presented a request to develop a competency-based supervision program at certificate and diploma level, and that approval has already been granted. And so I know we are also going to be offering a competency-based curriculum under the TVET programs.
I think Maureen has asked the question, how can one get accreditation? But I think you've already answered that question. You've given us a couple of spaces that are offering that as well. Someone has asked, what is the full name of SAPTA?
Catherine is there to answer the.
Hi, Professor.
Hi.
This is Catherine from SAPTA, and the full name for SAPTA is Support for Addictions Prevention and Treatment in Africa.
Okay. Thank you for that, Kathy. I wanted, someone has also asked a question, where can they find supervision in Kisumu, either taking the course or attending supervision? Would you have any ideas? Hello?
Hi, Debbie. I think Prof has, oh, she's there. I see her.
Yes, yeah, I have unmuted. Oh,
Okay.
SAPTA is support for addictions, prevention, and treatment in Africa. Thank you so much.
Okay. I don't know if you had my question, but there's a question that I've just, someone has asked concerning where can they get supervision or supervision as a course or just attending supervision in Kisumu.
Oh, in Kisumu.
Yes.
Wow, I'm not very sure, but I can find out from KCPA and then we can communicate through the platform tomorrow. But I know particular individuals like Professor Ken Ibuki, and I can write his number in the platform also. A counselor supervisor who is accredited by KCPA. Because again, you have to find out, is the counselor supervisor accredited or not? Apart from training, counselor supervisors need to be accredited, not only in Kenya, but even in other countries.
And there's a question that was asked.
Yes, Debbie.
You answered part of it. She asked where she can take supervision, because then she said KCPA office requested for a certificate.
KCPA offices requested for a certificate for?
For her to be able to take her supervision, because I think she needs to clarify what she meant.
No. What happens with KCPA, if you want to become a counselor supervisor, then you need to present a certificate in counselor supervision. That is the only time that you can be asked for a certificate in counselor supervision, because now you have applied for accreditation to become a counselor supervisor. Yeah, so it's going to be one of the requirements for counselor supervision. And you start from the associate accredited supervisor, and then you become an accredited supervisor.
Okay. probably maybe the last question you can answer is a question around your book. You can tell us more about your book, the cost and availability of it.
Right. My book on counselor burnout, a handbook for supervisors. Right now, we are having a few copies, and you can get it from Kenya Institute of Business and Counseling Studies. We've been having them in Textbook Center, but they told me they are not having the copies as at now. But we are having copies at our offices in Nairobi and also our offices in Thika. You can also write a message to me, and we can guide you further on that.
Okay. Thank you so much. There's been a number of comments just appreciating the insights that we have gained through the session, that it's been insightful and very timely during this time. For anyone who would be interested in getting the notes for the day, feel free to send your email to Helen, and she'll give you, she'll send them to you at a cost of 100 shillings. There's someone who's asking the question, where are your offices? Do you have offices in Thika? Where are your offices in Thika?
Yeah, we have offices in Thika opposite Gatomaine Primary School, as you're going to Thika School for the Bride or Chania High School.
And if anyone wants to find you, would you give us your details?
Yes. Do you want my email or my phone number is 0722-866-906. And the question about where would you do counselor supervision? As I said, we are having our TVET institutions. KIPCO is just one of the TVET institutions. We are offering counseling, counselor supervision through ODL, and also a continuous program within our institutions in Thika and Nairobi.
There's someone who's mentioned, there's a question that has been raised here, probably maybe I would not want to lock it out. Someone has mentioned that our clinical supervision has bias towards addiction counseling. What would you comment concerning that?
I wouldn't say so, because counselor supervisors are not trained. All of them are not trained in addictions counseling. And when you go for training on counselor supervision, addiction counseling will only come in when we are doing the unit of providing counseling in different contexts. But you're not trained to only offer counselor supervision in the addiction settings. So I would say that the supervisee who is requiring supervision should look for a counselor who is going to meet their needs. Do they want to be supervised in child counseling, in adolescent counseling, in what area of counseling, so that we can match the supervisee with the supervisor.
Okay. 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 Thank you so much, Kathy.
Yes, Debbie.
I believe we are done for the session today. All the questions have been answered, and guys are very grateful for the session and very insightful.
Helen's
and
number,
thank you for finding time to take us through this amazing information. Yes. She's posted it on the group. She's posted it on the group.
Okay.
Just yes.
Okay.
I can post it as well again.
Okay.
She's posted it to the group as well. Yeah.
All right.
Thank you so much for listening in. Unless Helen, do you have anything to say?
No, I don't have much to say, just to appreciate Prof for willing to share with us your information and your insight and your experience as a counselor and supervisor. We're really humbled. And thank you everybody for tuning in. Thank you, Debbie, for the wonderful show moderation. So thank you and have a good night.